Understanding myocardial infarction, causes, symptoms, and treatment. Myocardial infarction, commonly known as a heart attack, is a serious medical condition that occurs when blood flow to the heart muscle is blocked, resulting in the death of heart cells. Heart attacks can be caused by various factors, including lifestyle choices, underlying health conditions, and genetic predisposition. It is essential to understand the causes, symptoms, and treatment options for myocardial infarction to prevent and manage this life-threatening condition effectively. Causes of myocardial infarction. There are several factors that can contribute to the development of myocardial infarction. Understanding these causes can help individuals make informed choices to reduce their risk. Lifestyle factors. Poor lifestyle choices, such as smoking, excessive alcohol consumption, a sedentary lifestyle, and a diet high in unhealthy fats, cholesterol, and sodium, can significantly increase the risk of myocardial infarction. These habits contribute to the development of atherosclerosis, a condition where the arteries become narrow and harden due to the accumulation of plaque. When a plaque ruptures, it can lead to blood clot formation, blocking the blood flow to the heart muscle. Underlying health conditions. Several pre-existing health conditions can also increase the risk of myocardial infarction. These include hypertension, high blood pressure, hypercholesterolemia, high cholesterol levels, diabetes, obesity, metabolic syndrome. These conditions can cause damage to the blood vessels, leading to the development of atherosclerosis and increasing the chances of a heart attack. Genetic predisposition. Some individuals may have a genetic predisposition to myocardial infarction. If there is a family history of cardiovascular diseases, the risk of developing a heart attack is higher. Genetic factors can influence blood clotting, cholesterol metabolism, and arterial health, increasing the likelihood of experiencing myocardial infarction. Symptoms of myocardial infarction. Recognizing the symptoms of myocardial infarction is crucial for prompt medical intervention. Common signs and symptoms include chest pain or discomfort that may spread to the arm, shoulder, jaw, or back, shortness of breath, excessive sweating, nausea and vomiting, lightheadedness, heart palpitations. It is important to note that not all heart attacks present with the same symptoms. Some individuals, especially women, may experience atypical symptoms such as fatigue, indigestion, or upper back pain. Any unusual or persistent symptoms should be evaluated by a healthcare professional to rule out myocardial infarction. Treatment options for myocardial infarction. Timely treatment is essential to minimize damage to the heart muscle and improve outcomes. The treatment options for myocardial infarction include emergency medical care. If someone is experiencing the symptoms of a heart attack, it is crucial to seek emergency medical care immediately. Calling emergency services or going to the nearest hospital can help ensure prompt evaluation and treatment. Medications. Upon arrival at the hospital, healthcare professionals may administer medications such as aspirin, nitroglycerin, and clot-busting drugs to restore blood flow to the heart and prevent further damage. Angioplasty and stenting. Angioplasty is a procedure where a catheter with a deflated balloon is inserted into the blocked artery. The balloon is then inflated to widen the artery, improving blood flow. A stent may be placed to keep the artery open and prevent reblockage. Coronary artery bypass grafting, CAB. In cases where multiple arteries are blocked or angioplasty is not feasible, CAB may be recommended. This surgery involves using blood vessels from other parts of the body to bypass the blocked arteries, restoring blood flow to the heart. Diet and food to aid in myocardial infarction prevention and treatment. Adopting a heart-healthy diet is crucial for the prevention and management of myocardial infarction. The following dietary recommendations can help promote cardiovascular health. Consume a balanced diet. Aim to have a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Include a variety of foods to ensure an adequate intake of essential nutrients. Limit unhealthy fats. Avoid foods high in saturated and trans fats, as they can raise cholesterol levels and contribute to atherosclerosis. Choose healthier options such as olive oil, avocados, and nuts. Control sodium intake. Excessive sodium consumption can increase blood pressure. Minimize the use of salt in cooking and opt for herbs, spices, and natural flavorings to enhance the taste of your meals. Increase fiber intake. Foods rich in fiber, such as whole grains, legumes, fruits, and vegetables, can help lower cholesterol levels and promote heart health. Choose lean proteins. Opt for lean sources of protein, such as skinless poultry, fish, beans, and tofu. Avoid processed meats, which can be high in unhealthy fats and sodium. Include heart-healthy nutrients. Certain nutrients, such as omega-3 fatty acids, antioxidants, and vitamins, have been shown to benefit cardiovascular health. Incorporate foods rich in these nutrients, such as fatty fish, nuts, seeds, and colorful fruits and vegetables, into your diet. Moderate alcohol consumption. Excessive alcohol consumption can increase blood pressure and contribute to heart disease. If you choose to consume alcohol, do so in moderation, limiting intake to 1 drink per day for women and 2 drinks per day for men. It is important to note that dietary changes alone may not be sufficient for the treatment of myocardial infarction. Medical guidance and appropriate treatment plans should be followed for optimal management of this condition. Conclusion: understanding the causes, symptoms, and treatment options for myocardial infarction is crucial for disease prevention and management. By making informed lifestyle choices, seeking timely medical care, and adopting a heart-healthy diet, individuals can significantly reduce their risk of developing this life-threatening condition and improve their overall cardiovascular health.